Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it. Hi, everybody. Crystal Stokes here. And joining me today is Dr. Neil Shaw, who graduated from the University of Florida College of Veterinary Medicine. Go Gators.
Go Gators.
Oh, love it. And then he remained in Gainesville for an internship and residency in small animal internal medicine. After that, he became a diplomat of the ACVIM. He also founded the nation's largest group of specialty hospitals, Blue Pearl Veterinary Partners, and then served as the first chief medical officer for the Mars Inc. Veterinary Health Group. Neil has seen and experienced firsthand the impacts on the job of wellness on far too many veterinarians. He believes in reducing stress levels and improving mental health by providing veterinarians better support. With the different ways to provide support, Dr. Neil has decided to do so through what he knows best, medicine. Support veterinarians when making decisions to support better patient care and better outcomes. This is the reason for founding and leading SignalPET, one of the leading medical technology companies in the veterinary industry. Dr. Neil and a team of medical and technology experts have created medical technology that provides veterinarians instant support at the highest standard of care. A level of support that was once only available to a few is now available to all. Dr. Neil, thanks so much for being on with us today.
Crystal, thanks for having me. This is I really appreciate it.
Absolutely. Well, I'm excited to really hear more about your story today. Under the lens and the umbrella of Full Circle Labs, we talk a lot here on this podcast about this common pattern we see in the industry at large of veterinary professionals entering into the field full of passion and drive and energy. Along the way, a variety of events, internal and external, can happen that slide them down that cycle to the bottom of the circle, where they may feel burned out, exhausted, apathetic, and they may choose to leave the profession. And we're really big on trying to prevent that here. And that's something that we connected on, is really empowering veterinarians to protect their wellness and to thrive in the industry. And that's part of the genesis of your company, SignalPET. So I'd love to start there with that origin story and how you came up with this idea and the patterns you were seeing in the veterinary industry that inspired you to make change.
Crystal, it's a great point, and it's a great question. And I look back at my time in veterinary medicine, and I see the benefits, and I have to say I see the mistakes made as well. And if I can explain, I came out of veterinary school. My father was a veterinarian, and when I was finishing up, it was the early 90s, and specialty medicine was the new thing. And I remember calling my dad up, and I said, "Dad, there's a lot more that can be done in veterinary medicine than what I grew up doing, which were routine wellness and vaccines and some surgical procedures. But gosh, there's a whole lot more." And he kind of said, "Yeah, sounds good, but whatever." And so, but I went down this specialty path and ended up opening referral-only practices, specialty and emergency practices. And it was, on one hand, it was great. So we ended up opening in most of the major metropolitan areas, specialty referral hospitals that many are familiar with. And I spoke to thousands of veterinarians. I visited practices, I spoke at association meetings, I went to the national meetings, and I interacted, and I said, gosh, to practice great veterinary medicine in primary care practice, I was thinking of my father's practice, you should utilize referral. You should utilize case referral. And folks did. They did. And especially in emergency medicine grew, and I think that was great. Mm-hmm. However, when I look back in the rearview mirror, I think I made a mistake. I think I made a mistake because the message was sent that if somebody wants to practice great medicine, utilize referral. And that completely bypassed the primary care practice or the primary emergency practice, where tremendous medicine is possible, where tremendous medicine is done on a regular basis, and it was not accounted for. And if I were a pet owner, I would say, gosh, I want the veterinarian who I know, the veterinarian who I can see, the veterinarian who I can trust. I'd like them to have the confidence to care for my pets. If they say go somewhere else, I'll go somewhere else. But I really would like to trust and keep the relationship with the veterinarian that I have. And I think we became too segmented in the profession. We became much too segmented. We have. I looked back, and I have to admit, feeling responsible in part for this specialty in emergency that has grown, and then in primary care practice and primary emergency practice, we have tremendously talented individuals who have a fantastic education, who are really smart. And I think in part they're getting beaten up on. They're getting beaten up on. They can practice great care. They can deliver great care. They can deliver value to the pet families, and nobody's telling them it's okay. Please do that. It's okay. You've got this. You've got this. And as a profession, we're not good at saying that. You've got this. You are doing well. When I met who's currently our CEO, my partner Lior, and his background is in AI and software, and I started talking with him, and I said, Lior, what makes good software? Do you need so many cases? Do you need these statistics? What is the accuracy? And surprisingly, he said, if software works, people are happier. And that's when the software is successful. And I was thinking of statistics. What is the sensitivity, and what is the specificity, and what are the outcomes? And he said, if people are happier, then it's good software. And so when we use our iPhones and we use a GPS in the car, and when we call an Uber, we're happier. And he was right. He was right. He was absolutely right. And so I feel really enthusiastic because software, not only when done right, can make people happier, it can make people more confident. And the ability to do that to a larger population, which technology allows you to do this at scale, is fantastic. Is absolutely fantastic. So rather than a one-on-one relationship, which I grew up with, and a close-knit relationship to help folks through their day, through their routine, through their week, through their year, but to be able to do this on a instant basis, on a moment-to-moment basis, thousands of times over every hour, that's when you see what's happening in the world of technology and AI and all that, and apply it to circles that and then the light bulb just goes off, and you go, "Wow, this is magic." This is magic. This can really help.
I love it. So can I backtrack and ask you,
please,
when you were looking back on you were mentioning some of the regrets you had around the contribution of sort of this segmentation within specialty, or becoming siloed. Do you feel like when you look back on these changes and where we're at now in veterinary medicine with primary care and the relationship between primary care and specialty hospitals, are you seeing anything within that relationship or how it currently works, whether it's related to technology or not, that's hard on veterinarians, that diminishes their wellness?
Very much so. Very much so. Because what we've developed is a system where the primary care practitioner is second guessed. And so we have a one-way relationship where specialists expect folks in primary care, which is the vast majority, to report into them, but the specialists don't report into the primary care. And at the end of the day, it is the primary care providers that, one, take the most heat, 2, work the hardest, and 3, are ultimately responsible for outcomes of cases. They truly are. They are truly out, and they feel that responsibility. They feel that heavy weight of responsibility. And I don't believe they get the same degree of support or respected for that degree of responsibility than we do on the specialty side.
What is happening there when it comes? I'm thinking of human medicine. For instance, if my GP refers me, let's say, over to radiology to have something checked, the radiologist, shoots the X-rays, the MRI, sends a report back. Then often my GP is the one that meets with me to go over the findings of that. Where's the breakdown in veterinary medicine that circular process isn't happening?
It's fascinating. It's a great question. It's fascinating because human medicine went through a very similar cycle. And the specialists, if you will, reigned supreme actually just a few decades ago. And then what happened is in human medicine, the recognition was there that, wait, we're making a mistake here. And the trend was back to, emphasis was replaced on primary care. Wow. And so actually, if you go to some of the latest terminology, the true specialists are considered the primary care providers. And then they utilize here in a very focused manner others, but the true specialists are the primary care providers. And human medicine turned around and said, we're making a mistake because the biggest healthcare benefit is provided by the primary care providers. Mm-hmm. How can we support the primary care providers? And we will do that over time, I anticipate, over time in veterinary medicine, as this realization comes through. The primary care providers are, on one hand, they take the most heat. On the other hand, they have the most opportunity to, if you will, do good. They are the ones that instruct folks on what to do. They're the ones that people trust, mm-hmm. and that trust should be respected because the trust is earned. 100%.
Well 100%. Said.
Yeah.
Well, to bring this back to SignalPET, you're describing this realization with your partner Lior, your CEO, around the potential opportunity to use and leverage technology and AI to really help boost confidence and decrease stress. So I'd love for you to share more about the development of SignalPET and what exactly it does. How does it help boost confidence and reduce stress for veterinary professionals?
Yeah, Crystal, great question. Perfect. Absolutely perfect. As a veterinarian or a veterinary professional, what happens is, say in the examination room, pet is limping or is sick or vomiting or not eating or having some issues. The owner wants to know what's wrong and can you tell me now? And especially today's world of information flow, you must be able to tell me quickly. You must be able to tell me quickly. And by the way, can you demonstrate it to me? Because I know you and I like you and I trust you, but I want to take this home and show my spouse. And my spouse is going to say, well, where's the paper? And so I think that as a profession, we have to evolve to these expectations. And they're fair expectations. It's if you will, it's a consumer society. So how do we evolve to those expectations? One is we turn the art into the science. So specifically with SignalPET is able to, and I say this with absolute confidence, take a X-ray or a radiograph, and when we as professionals used to say, I think there may be an unusual pattern to the bowel here, or I think that this bone has a fracture on this angle. It's possible. So that's a very, it's a meaningful statement, but at the same time, it could be a fracture, it could not be a fracture. Nobody's really committing one way or the other. What SignalPET says is, yes, there's fractures, no, there's not fractures. Very straightforward. Yes, there's an abnormality to a bowel. No, there's not an abnormality to the bowel. Yes, there's a pattern in the lungs. It's due to heart failure. No, it's not due to pneumonia. And so and it does it in minutes, right? As soon as the radiograph is taken, it goes to the cloud. It's worked in the cloud, and the answers come back. And so that gives the clinician the technician who's responsible for relaying the results a lot of confidence to go talk to the owner and say very quickly in real time, yes, your pet is limping. No, there are no fractures. We can be comfortable. It's just a muscle sprain.
Wow.
And then they can give a report. And here's a report. And you can Mrs. Client, you're welcome to show your family. Here's the report. And so for the client, it increases a client happiness. Importantly, the veterinarian still looked at that radiograph, that's the x-ray, still determined that, no, I don't think that there is a fracture, but received the reinforcement and confidence that, yeah, indeed, there is no fracture there. That's just, if you will, artifact. The client is happy, the pet is better served, and the cost is significantly lower than what we're used to in veterinary medicine.
And how so? Is it because we don't just send it out to a specialist to be read? Is this primarily something that a GP would utilize?
It's interesting. Yeah, perfect. In comparison to traditional readings, it's about one tenth of the price of traditional readings. So it's a much lower cost, and the only reason we do that is because we do it all around the world, thousands of times a day, and so we can do it at scale. So it's a fraction of the cost of having, say, a radiologist read the films. Mm-hmm. And the turnaround is not a day or 2 days or an hour. It's within minutes. All right.
Okay, can I play the skeptic now?
Please.
All right, because I love this part. All right, I'm putting on my vet med professional hat and saying, how is this? I'm skeptical that this is really going to be accurate. Like, what would I do if it's, let's say I order a radiograph, and then I get the report back from SignalPET and I don't agree with it? What do? I say, I'm suspicious that this isn't correct. What are my next steps?
Perfect. You say, I don't know if this is, so I'd like an additional opinion, and you can send it in for an additional opinion. No problem. On SignalPET, you can either do it directly to us by chat, or if you want, say, an individual, say you want a radiologist or a specialist to look at it, whether it's through SignalPET or through another service, you can send it in, and it's no problem. And if there's any change, by all means, let us know. Mm-hmm. We track the percentages. For customers or veterinarians or veterinary clinics who use SignalPET, they will ask for an additional interpretation 0.5% of the time. Mm-hmm. So 0.5 out of every 100 cases will request an additional radiologist consultant. Totally respected. And it can be done through SignalPET, or it can be done elsewhere. The other aspect is to look at, we do a tremendous amount of quality control, a tremendous amount of science. It is actually, we've set the standard for AI in radiology. Actually, and I'm going to state this, in human medicine as well. So very familiar with what's happening in human medicine. The journal paper, we actually didn't run the study. So we were asked to participate in the study. It was run by economists, academic economists that were looking at AI. They utilized a radiologist who is in academia, who's very well respected. He's boarded in Europe. He's boarded in the United States. He's head of the AI Radiology Council, and compared us to a number of other radiologists, us being SignalPET as AI, and we consistently beat the majority of radiologists every time for every case. Mm-hmm. And so I think that's going to be presented this year. It's going to be a revolutionary study, and it'll actually be presented at the radiology meeting, the ACVR meeting in October. But it's so the science is there. Importantly, we will read really many tens of thousands of studies, several 100,000 films a month, a couple 100,000 films a month for veterinarians in practice in the United States, in Canada, in Australia, in the United Kingdom, in Europe, in the Middle East, really in globally. And we actively, in addition to our own quality control program, we actively receive and solicit feedback. And so we're very comfortable with the results that are provided.
Great. Can you describe to those listening how it actually works for those that may not be very may not have much experience with artificial intelligence? How does this work? Can you share that in the background, how this works?
Sure. I'm happy to. So what happens is, from a user standpoint, from a veterinarian or veterinary technician standpoint, the study is taken. It automatically is uploaded to the cloud. We process it from the cloud and then deliver to any computer terminal or phone the results within 10 minutes. Usually it's about 3 or 4 minutes. So it's very simple. It's very easy. As Lior said way back in the beginning, it makes life easier for folks when they use it. From a development standpoint, we had to develop our own standards. There aren't great standards what currently exists on radiographic findings. So we went through an entire process, multi-year process, looking at literally millions of films and data, and then taking data points from each of those films. We had to reinterpret our films ourselves and identify key features and train the computer to recognize specific syndromes. And actually what happens is the computer identifies the patterns and we confirm what those patterns are. Mm-hmm. And it's similar to what I found in part. It's similar to training a first or second year veterinary student. This is a X-ray, and this is light, and this is dark, and then this is bone, and this is a metal, and this is a soft tissue and fluid and such. This is the chest, and this is the abdomen, and these are the legs, and progressively becoming more and more and more and more detailed, and then having the system identify the patterns and confirming what those patterns are. Mm-hmm. And that's never been done before, and it's an amazing process. A lot of work has gone into the background, but what it results is in a really seamless system. Yeah.
Very interesting. So what if I'm a radiologist, veterinary radiologist? Should I be worried? Like, is this competition? Well, is there a way that it would enhance my career? Could it actually diminish my work? How are the radiologists receiving this technology?
Yeah, it's the short answer is it is a boon for radiologists, but radiologists are not going to recognize that in the beginning. They don't. And so what happens is we have become so good at what we do is we can actually identify that everything on an image, and actually with the latest AI, make recommendations based on a clinical history. And we can do that with AI. And if radiologists want to use this as to initially review, confirm the report, it's like having their own resident, if you will, and then confirm the report and to give a signed report, they are welcome to use the system. And that's the future. That's the future. I can tell you that, yes, sitting, looking at a film, identifying patterns on a film is in 5 to 10 years from now, very few individuals will do that without it being read by AI first.
Mm-hmm. I would still say that even if that is the case, there's nothing that really can replace that personal relationship you would have with your doctor. So for, say me seeing my radiologist and having that, their comfort, their expertise, their help in planning the next steps, just that personal human touch really is something that doesn't ever go away. And I hope that radiologists can feel confident in being able to continue to provide that with the extra confidence of having this AI or technological support that may just enhance their efficiency, enhance their confidence, their ability to move forward more quickly, but still maintain that strong, very, very needed critical relationship with their client and patient.
I think you're absolutely right in that there is tremendous opportunity for radiologists within practice to work within practices as individuals, as specialists, to contribute to patient care. I think there's a tremendous opportunity for that in hospitals, in clinics and in hospitals. And there will always be a need. There'll always be a need for that, especially as it relates to doing procedures. Mm-hmm. Especially as it relates to doing procedures and perhaps performing ultrasounds. The opportunity for radiologists will continue to grow. just because calculators were invented, it didn't mean there weren't any more opportunities for people who used to count beads on an abacus.
Mm-hmm.
So just because we have calculators to process numbers quicker doesn't mean that there isn't opportunity for folks to advance their own skill set. And that's what will happen with radiologists.
Good point. I think whenever there's a new change, it's always a bit scary, but when we watch how we adapt over time and we just shift our what we are working on, it just expands the ability to move into other areas and have more opportunities. So I hope that with time that we find our way with this. I'd love to change tracks just a little bit and ask what you have witnessed as a result of veterinary hospitals implementing SignalPET technology. What sort of feedback have you gotten from veterinary professionals on their quality of life, their well-being, their confidence after using this technology?
Yeah, no, fantastic. Veterinarians are happier. The short of it is veterinarians are happier. And I'm going to paint two scenarios for you, and I'm going to tell you the results objectively. So one scenario is a veterinarian. Maybe it's in their first couple of years out of veterinary school. A patient is limping, and say it's a large dog that's 2 years old, and sometimes they can be growth abnormalities. Sometimes they can be trauma, and things like that can result in a 2-year-old large breed dog limping. And so the veterinarian says to the owner, they know for sure that radiographs or X-rays are recommended in this case, but they think to themselves, and the stress starts: should I take radiographs? Because if I take radiographs, then I've got to interpret it. And if I interpret it correctly, great. And if I miss something on the films or I misinterpret them, then there's a permanent record, and somebody else who looks at this is going to say I missed something, or the owner's going to question it, or da-da-da-da-da. And so, and what actually happens is the stress level for the veterinarian rises. The pet family doesn't receive the value, and the pet doesn't receive the benefit of the procedure, which is getting the X-rays. And that's actually what happens in most scenarios today. Once you have a tool such as SignalPET to provide if you will, a second set of eyes to assist with the reading and give confidence to the veterinarian, then they can say to the owner, I know it's a 2-year-old dog, sometimes these can be difficult to read, but we're going to do this and we're going to give you an answer. They know with confidence they can strongly recommend films with confidence, have the films read out, and provide an answer whilst the owner is still in the exam room without having to come back.
Yeah. And pinning that, I think another aspect to that is, the budget. People come in with a tight budget, and if you are able to provide a service that at a reduced rate, like, compared to having the radiographs read by a specialist, or like you said, you can provide it at a lower cost. I think that can often lead veterinarians to feel more comfortable with recommending having radiographs read, but the budget is often a big issue for people bringing pets in.
Completely raise the level of care and lower the barrier. In this case, the financial barrier to care. Absolutely, and veterinarians can do that. And so now, as a result, if they have SignalPET, they do that. And statistically, we look at the numbers, we compare it. We're a data company. On behind the scenes, hospitals that utilize SignalPET confidently, statistically take more radiographs than they do, and with a lower price, take more than they do beforehand, before they use SignalPET. In addition to that, hospitals that same client base, same economic conditions, same patient load, hospitals that use SignalPET progressively take more radiographs as time goes on, and they utilize SignalPET more and more. And nobody's telling them to take more films. They just have more confidence. They have more confidence, so they do more. So what happens is the hospital benefits, the hospital finances benefit. Crystal, great point to your point. The owners aren't spending as much money individually as they used to have to, or send it out for an individual consult. So the cost is less, and the turnaround in the service is much quicker. Everybody wins.
I definitely can feel as a pet parent, getting that instant readout would be very satisfying. We all want the instant gratification.
Right.
You said you had 2 examples, and that was one. Do you want to share the other story?
I will. Thank you. I will. The part of what I do is I've been very fortunate, very blessed to have a long career in veterinary medicine, and so I keep in touch with large numbers of veterinarians. And it is common. It wasn't a one occasional occurrence. It wasn't here and there. It is common that veterinarians now, in ones that I knew, so I knew them when they were first young graduates, and now they're, if you will, middle in the middle tier, commonly have said, if I had this technology when I was young, when we used to talk, I would have been a better veterinarian today, because I would have been more adventurous. I would have been more progressive in my medicine, because I would have had more confidence. I would have felt better about it. And by the way, sometimes if it's a corporate practice or such, the economics will always play out, and everybody is more positive and feels better. So veterinary medicine should not be about making money, but those who are vested in making money in veterinary medicine, it's a positive outlook. Importantly, from a well-being output, without a doubt, the feedback is consistent. Folks feel stronger professionally, and most veterinarians that I know, being a veterinarian or being a veterinary technician, it's almost their most, if not the most important identity that they have about themselves. And if they can feel better about being a professional, frankly, they feel better about themselves. And I see this again and again and again, and it comes back. When is software successful? It's successful when it gives you confidence. It works. It gives you confidence. You don't have to think about how, where, or why. It gives you confidence, and that's what modern software does. Yeah,
it's wonderful.
Yeah.
For so many of the veterinary professionals that I work with, from a personality profiling standpoint, many are high on perfectionism and wanting things to be perfect.
Right.
And with that desire for perfectionism, it can really take a toll on confidence, because it can be very hard to hit that mark of perfection, and often it's impossible. But I think what SignalPET does is it just helps us get a little closer to that goal of trying to be as perfect with the diagnostics as possible, to give that pet as much quality of life as we can. And so I think that this sort of service does speak to that. And I wanted to, as we're rounding out our conversation today, coming down the home stretch, to zoom out for a moment and just leave our listeners today with your top 1 or 2 takeaways. If they were going to forget everything we talked about in this podcast, but we want them to remember 1 or 2 things, what would those things be?
2 things. One is, don't be afraid of change. Don't be afraid of change. Don't be afraid. And 2, technology will make you better. It won't replace you. You will be a better person. You'll be a better professional, but you're not going to be replaced. And I say that with absolute confidence.
Beautiful. Well said.
Yeah.
So for people listening today, if they're curious to find out more about SignalPET or connect with you, where is the best place for them to look?
Our website, www, I had to think about that, .signalpet.com. And if anybody, I'm happy to I love veterinary medicine, love veterinarians, love veterinary professionals, happy to have a conversation. It's just Neil, Neil, @signalpet.com.
Wonderful. So I will put that in the show notes so people don't have to dig for it. That'll all be linked up for you there. And Dr. Neil, I so appreciate you being on today. It's been a very interesting conversation. I've enjoyed learning more about the history of SignalPET.
Crystal, I appreciate it. Thank you very much.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.